The PyCath system by Medyria, an innovative microcatheter aiming at accurate diagnosis of cardiac ischemia in obstructive and non-obstructive coronary diseases. Ischemia is a condition characterized by chest pain. It can manifest as either acute or chronic, increasing the risk of myocardial infarction, which impacts 112 million individuals globally. While pressure-based FFR techniques excel at detecting focal or diffuse atherosclerosis, the correct diagnosis of other conditions requires the simultaneous assessment of blood pressure and flow. Currently, the availability of precise and consistent tools for measuring parameters associated with flow velocity is limited. The PyCath system consists of an equipment part with a catheter unit, a control unit, a medical-grade panel PC for display of the user interface, and a single-use microcatheter. The PyCath microcatheter incorporates a cutting-edge blood flow velocity sensor, a state-of-the-art pressure sensor, and a rapid exchange section with a reduced in-lesion and entry profile. The PyCath microcatheter is compatible with standard workhorse guide wires. The PyCath system is fully integrated into the cath lab, and it enables straightforward use with the standard procedure. Upon activation, the system initiates the collection and tracking of parameters: aortic and distal pressure, instantaneous blood flow velocity measurement, and real-time microvascular resistance. In case of epicardial stenosis physiological study, the system allows the performance of both hyperemic FFR measurement and non-hyperemic measurement using a customized index. In the case of ischemia with non-obstructed coronary arteries, or INOCA, the system allows a full study of the heart's physiology with a modality called full Pi, or full physiology. The system acquires the resting signals of both pressure and blood flow velocity for 10 seconds. In this time, the operator can visualize the pressure and velocity profiles, as well as the online calculation of the microvascular resistance and the PD divided by the blood flow velocity index. In a second step, the system guides the physician to induce hyperemia, either through IV or intracoronary infusion. The hyperemic phase is then recorded for at least 5 heartbeats. When the physician presses stop, the system automatically identifies the resting and hyperemia phases, which is either corrected or accepted by the physician. The full physiology analysis is then concluded with the simultaneous measurement of fractional flow reserve, or FFR, coronary flow reserve, or CFR, hyperemic microvascular resistance, and relative reserve ratio, which are quintessential indexes for the correct diagnosis of ischemia in patients with non-obstructed coronary arteries, or INOCA patients. PyCath aims to become the best in-class device for full physiological assessment with simultaneous measurement of pressure and blood flow, aiming to improve medical practice and reduce healthcare costs. PyCath by Medyria, committed to improved patient outcomes.